Hello everyone, and thank you for joining this session. My name is Dr. Emmanuel Boselli, and I am an anesthesiologist and researcher at the University of Lyon in France. Today, I would like to share some practical insights about how to reduce preoperative anxiety and increase patient comfort during anesthesia, in particular regional anesthesia. So during this webinar, we will look at both pharmacological and non-pharmacological strategies and see how the second group can be extremely powerful, evidence-based, and easy to integrate in daily practice. Before we start, here is my disclosure statement. I have received research grants from the Fondation Apicil for studies related to analgesia and patient comfort and support from Fresenius Kabi and M. Dolores Medical Systems. In addition, the companies Fujifilm Sonosite, Mindray, and B. Brown have kindly provided ultrasound machines and regional anesthesia equipment for educational workshops that I have organized. I have no other financial or personal conflicts of interest to declare. Let's begin with a short poll. Poll number one. Question one, do you routinely use pharmacological medication to reduce preoperative anxiety? So please choose one of the following options. A, always, B, never, and C, sometimes. Many of us were trained to give small doses of midazolam or other medications such as ketamine or other, sometimes even before meeting the patient, but recent evidence and clinical experience have shown that this may not always be the best option. Now, let's move to poll number two. How do you usually manage anxiety during regional anesthesia procedures? Please select the answer that best reflects your practice. A, medication, such as propofol, midazolam. B, hypnosis, like medical hypnosis. C, virtual reality. D, other. From your answers, we can see how different our approach can be. Let's now explore both pharmacological and non-pharmacological strategies to increase patient comfort during these procedures. This slide shows the abstract of a prospective double-blind study published in the Annales Françaises d'Anesthésie Réanimation in 2010 by Dr. Régis Fusier. The objective was to evaluate the impact of anxiety on the success of an axillary block. This study included 184 patients, and the results showed that the patient's anxiety level before the block was a risk factor for block failure, particularly in an emergency context. This study suggested that anesthesiologists should evaluate a patient anxiety prior to block performance and may recommend a specific anxiolytic treatment in some cases. This next article, a survey from the Journal of Anesthesia, looks at the utility of the outpatient preoperative anesthesia appointment. The conclusion states that the preoperative anesthesia meeting plays an important role in educating patients regarding anesthesia. Importantly, it was found to influence patients' choice of anesthetic while also significantly reducing overall patient anxiety. The graph illustrates the decrease in patient concerns after the clinic meeting for various fears, such as nerve damage, paralysis, and awareness, all showing a statistically significant decrease. Moving on to pharmacological approaches, this randomized clinical trial on sedative premedication was published in the JAMA in 2015. The conclusions and relevant section highlights that for patients undergoing elective surgery under general anesthesia, premedication with lorazepam compared to placebo or no premedication did not improve the self-reported patient's experience the day after surgery. Furthermore, it was associated with a modestly prolonged time to extubation and a lower rate of early cognitive recovery. The findings suggest a lack of benefit with the routine use of lorazepam as sedative premedication in this context. This study, published in the Journal of Anesthesia in 2023, investigated the sedation efficacy of remimazolam, showing short half-life, with sufentanil for nerve block. The conclusion states that remimazolam at 0.08 mg per kilogram provided the best sedation efficacy in young patients. For elderly patients, remimazolam at 0.04 mg per kilogram was preferred, with the trend of less respiratory adverse events. Now, let's consider the non-pharmacological approaches. The main image on the slide illustrates the recent and very significant increase in studies found on PubMed concerning non-pharmacological techniques, including virtual reality, medical hypnosis, and other methods such as music or aromatherapy. This trend shows a growing interest and body of evidence for these patient comfort strategies. Focusing on virtual reality, a meta-analysis of randomized controlled trials from the Journal of Clinical Medicine in 2023 aimed to validate its effect on preoperative anxiety. The abstract concludes that virtual reality could significantly decrease preoperative anxiety. This effect was especially noted in pediatric patients where the anxiety scores were lower in the VR group than in the control group. However, this observational study from the Journal of Medical Systems in 2023, including 99 patients, found different results in the use of virtual reality during axillary block performance. It found that the difference in the numerical range scale for anxiety before and after the axillary block performance did not differ in the virtual reality group compared to the group without a headset. Furthermore, the virtual reality headset did not reduce the patient's anxiety during a peripheral nerve block. Next, we look at hypnosis. This randomized trial in the British Journal of Anesthesia in 2020 investigated the effect of hypnosis and communication during peripheral intravenous cannulation. In the hypnosis group, a confusing question such as, "And is your truck still going to the swimming pool?" was asked during the procedure to enhance the hypnotic effect. The results shown in the box plot indicate that the hypnosis group had significantly lower pain numerical rating scale scores compared to both the neutral and nocebo groups. This quasi-experimental pilot study that I have published in the International Journal of Clinical and Experimental Hypnosis in 2018 was designed to determine the effects of conversational hypnosis on patient comfort and parasympathetic tone during regional anesthesia compared to premedication with hydroxyzine. Our findings suggest that using conversational hypnosis may be followed by a subjective increase in patient comfort as well as an objective increase in parasympathetic tone monitored by the Analgesia Nociception Index or ANI, showing better comfort in patients with conversational hypnosis compared to premedication. Another non-pharmacological approach is music therapy. This article discusses music therapy during total knee arthroplasty under spinal anesthesia. The study's results showed that subjects in the music group had a statistically significant lower anxiety score compared to the control group, both pre- and post-operatively. Patient satisfaction scores with their perioperative experience were also higher in the music group. Finally, we consider aromatherapy. This randomized controlled trial evaluated the effect of lavender aromatherapy in reducing intraoperative anxiety in patients undergoing a Cesarean section under spinal anesthesia. The conclusion found that the effectiveness of lavender aromatherapy significantly reduced the need for intraoperative anxiolytics. This makes it an alternative for pregnant women undergoing Cesarean section under spinal anesthesia. So, to summarize, if you choose pharmacological sedation, select mainly propofol because it has a short half-life, predictable recovery, and minimal side effects. Avoid the use of other medications such as midazolam or ketamine. If you prefer non-pharmacological approaches, you can combine hypnosis, virtual reality, and music therapy for even better results without the risk of oversedation or delayed discharge. Both options are complementary, not exclusive. The key is to adapt your approach to each patient's personality, level of anxiety, and the type of procedure. So to conclude, reducing preoperative anxiety is not only about medication. It is about creating an atmosphere of trust, presence, and safety. Non-pharmacological techniques allow us to achieve this. They empower all the patient, humanize anesthesia, and improve outcomes. In short, the take-home message is less drug, more connection. Thank you very much for your attention, and I'll be happy to take your questions.